A new study shows the COVID-19 variant first detected in the UK is actually deadlier than other strains of the virus. We already knew that it was more contagious, but this new data shows that people infected with the UK variant have a 61% higher risk of dying. So we want to bring in Dr. Neeta Ogden. She's an internal medicine specialist and immunologist. Dr. Ogden, researchers also wrote in that study that people who catch this variant of COVID-19 could be more likely to experience a more severe version of the disease, more severe symptoms. We've talked about how these variants change over time. How is it that this virus could have become so much more dangerous so quickly?
Good morning. So, we actually don't know why this variant is more transmissible and possibly more severe. That's actually one of the comments that the authors of the study that was published in Nature admitted to that could change the interpretation of their results, which basically showed that among over 2 million COVID positive tests in England taken from September to February, they used projection models that showed that there was a 61% higher incidence of mortality projected out to 28 days. The things to keep in mind here, though, is that number was really significant for people who were older. They found that in people over the age of 70, so from 70 to 84, that risk of mortality went up by 1.5 percentage points. Over 85, we saw the risk now increase to 19 to 25%. So it is important to keep those kinds of things in mind, because they did say as well that the risk of mortality is still very, very low when you're looking at an entire population. So I think there's still more information to be had here, but we do know from this evidence that there is likely a higher chance of mortality, especially in older age groups.
Yeah, and it's really concerning that you're seeing sort of this third wave in Europe, and some have suggested that we could be facing something similar, and that this UK variant, or this variant that originated in the UK, could prove problematic for us here in the U.S., even as more and more Americans are getting vaccinated. Doctor, let me also ask you about this vaccinated woman in Florida who gave birth to the first baby known to have COVID-19 antibodies from a mother who has gotten her vaccination shot. That new mom's a healthcare worker. She got her first dose when she was 36 weeks pregnant. Researchers detected the antibodies in a blood sample from the baby's umbilical cord. So what does this mean for babies and whose moms have been vaccinated? I know that we've spoken to doctors like yourself who have said to us that even if you're pregnant, you should receive the vaccination.
Yeah, I thought this was a great story because it really starts aligning the COVID vaccine with those vaccines that we already use in pregnant women, like the flu vaccine, the diphtheria tetanus vaccine. We really need, and it's clear that we need, significant data on how safe it is in pregnant women. And this also is hopeful because it offers a level of protection to one of the most vulnerable populations, the newborn. We don't even have vaccines in children. So if we can see this kind of safe maternal transmission of antibodies from the vaccine to newborns, I think that's really a great step in the right direction, and also a step towards getting more and more information about this group of people, pregnant women, that is really sorely needed during this pandemic. So I think it's really, really hopeful to hear about it, and that it was after the first dose of the Moderna vaccine in this healthcare worker.
I want to ask you about a non-COVID story that came out. A scientist in California detected 55 chemicals in pregnant women that had never been reported in people before, including chemicals from cosmetics, pesticides, plastics. The chemicals were detected in the blood of the women, which means blood that they're sharing with newborns, also detected in the newborns. So what does this study tell us about just the kind of chemicals that we are exposed to on a daily basis and the sort of impact that it may be having on us?
Yeah, so, I found this alarming and a bit infuriating. We continue to be exposed to chemicals through products in our everyday life. And really, that the technology's improved and allowed us to detect these chemicals, which probably have been around for quite a long time. I think that this points to the fact that manufacturers really need to provide analytic standards that look at these chemicals, allow us to identify them, and really evaluate their toxicity. And then that really plays into the EPA also stepping in and creating higher regulation standards where, again, these types of chemicals will be easily detectable. We know what their, analytics are involved in finding them and discovering them, and then seeing how they impact human beings. I mean, the thing about this study was that it was in pregnant women and their newborns where these chemicals were detected, and they were found in everyday products like cosmetics, nonstick cookware, pesticides. So I just think that they're so important to put a greater lens on this. We really need to see what's arriving, into our own bodies and those of newborns, especially in our children.
Yeah, it's remarkable that, there's been concern by some about these vaccines, and yet we're constantly exposed to things that are detrimental to our health and our well-being. We constantly ingest things that we're told by doctors like yourself, processed foods and alcohol and tobacco that we know will be life-threatening. So this data and this report is just sort of an interesting sort of detail that there's many, many chemicals that we're exposing ourselves and the unborn children to, which people should find concerning. Dr. Ogden, always great to have you. Thank you.
Thanks for having me.